So very briefly, I'm Marianne Jump. I'm the archivist and library manager at the Marx Memorial Library. We're really delighted to be hosting this event. It's a real shame that we couldn't host it in our lovely building on Clerkenwell Green, because we would have been holding it in the hall which is home to our Spanish collection, our archive on the Spanish Civil War and the British response to the Spanish Civil War. And the hall was adorned with banners of the international brigades that would have been very appropriate. For those of you who don't know much about us, we're a library and archive, an education charity. As I said, we've got a library of about 50,000 books and journals on Marxism and the history of socialism, and one of our main collections is our Spanish collection, which is about 150 boxes of original documents on the Spanish Civil War, and that's searchable on our website, and we've also got a number of digital resources up there, so do check that out. We're hosting this event joint with the International Brigade Memorial Trust, which is a charity which keeps alive the memory and spirit of the men and women from Britain and Ireland who volunteered to defend democracy in the Spanish Civil War. The IBMT organises meetings, education work and other events, and I think many of you may have seen their latest magazine, which featured an article from David and Mark Darby on David Lowe, on Doug Jolly, sorry. Right, I think that's enough from me. I'm just going to introduce our speaker. So David is an intensive care specialist at St Vincent's Hospital in Sydney, and he's involved in the day-to-day management of trauma and cardiothoracic transplant patients amongst critically ill. His interest in the life and work of New Zealand surgeon Dr. Doug Jolly was sparked by reading a biographical paper published by the American surgeon David Adams in 1990. Since then, he's been researching in the family archive found in Canberra and various other sources across the world, in Canada, New Zealand, Spain, the USA, and Australia. If people could, who are logging in, can you please keep your videos off, please? Thank you. And he's currently working on a full biography of Dr. Jolly at the moment, so I'm really looking forward to hearing more about his research. Thank you.
Okay, thanks Marianne for that very kind introduction. I'd just like to start by thanking the Memorial Trust and the library for arranging this event and allowing me to speak. And right from the outset, I've got a few thank yous. There'll be more at the end, but I'd first of all like to thank Mark Darby from New Zealand, one of my collaborators, who I now count as a friend. John Wainman in Canada, whose father, Alec, as a Quaker, volunteered for the Friends Ambulance Service and served in Spain and took many of the photos that you'll see today, many of which haven't in the past probably had the recognition that they deserve. And two families, the Jones family in the Canberra region and the Jolly family in New Zealand, and particularly the Jones family who have very generously given me free access to the papers and possessions of Dr. Douglas Waddell Jolly. And what you see on the first slide is a picture of two of those possessions from the archive, as I'll refer to it. On the left is the British Army armband that Doug wore at Tobruk and in hospitals close to Monte Cassino in Italy. And on the right is part of his uniform that he wore as a major in the Spanish Republican Army, acting as a medical officer. So Doug obviously cut that from his uniform and treasured that for the rest of his life. The next thing to say is I'm not a historian and I'm not a biographer. And as Marianne said, I'm a practicing intensive care specialist. Unlike Doug Jolly, I'm not a surgeon, but I suppose what we do share in common is the fact that I grew up in England, in the country where Doug spent the vast majority of his adult life. And we also share something in common, that we obtained our primary medical degree at university in New Zealand. So I'd like to start, well, where it started for me, as Marianne said, was this paper that was written in, published in 1990 by an American trauma surgeon called David Adams. So that's 30 years ago that the paper was published. I think I probably read it probably 20 years ago when I was in the library, when I probably should have been studying something serious, related to my work, but I drifted off down a historical pathway because the article intrigued me. The first thing is it was published in a relatively obscure surgical journal, not one of the mainstream journals, but it described a surgeon who trained, as I did, in New Zealand, who volunteered for the Spanish Civil War, which has always interested me, performed a huge volume of surgery, and then from that wrote a book, which is now largely forgotten. But according to this article, the book was very influential in Allied battlefield medical military planning, particularly at the start of the war. And I was intrigued by this. How could I have trained in the same country and never heard of this man? I'd heard of other New Zealand doctors, such as Sir Robert Mackintosh, who was the first professor of anaesthesia in Oxford, who, if you read the history books, he also served in Spain, but he actually volunteered for 6 weeks service with the nationalist side. So this was quite different. And I was intrigued and I wanted to find out more. So one of the first things I did was contact Dr. Adams. And he, with the article being published in 1990, only 7 years after Doug died, he had the benefit of being able to contact some doctors who'd worked personally and knew Doug, including, as you can see there in the bottom right-hand corner, Dr. George Comrower, who would go on, well, who had written, rather, Doug's obituary in the British Medical Journal. David has been very helpful, but unfortunately all those original documents have been lost. So we really had to set out on a path by ourselves to find out more about Doug. So that's where it started for me, but where did it start for Doug? Well, Doug was born in Cromwell in the South Island of New Zealand on the 16th of December, 1904. His forebears had come from Scotland, as many in the South Island had, and his grandfather, David Jolly, started a general store, which you can see pictured here, which really serviced Cromwell, which was a gold mining town. And Doug was one of 6 children born to William and Elizabeth Jolly. He went on to attend Otago Boys High School, and here's a prefect's photo showing Doug furthest on the left in the early 1920s. And as any red-blooded New Zealand male from then, or really forever, Doug played rugby. And this is a picture of the Otago Boys High School first 15 from 1921, and Doug is the player with his left hand on his knee, standing next to the coach. And for instance, the Otago Boys High School badge on Doug's shirt is in the archive. He kept everything. This picture is of AC, or Alexander Aitken, who is probably New Zealand's most eminent ever mathematician. The significance of Alec Aitken is the calibre of the man. He fought at Gallipoli. He then became a professor of mathematics in Edinburgh and spent the rest of his life in Scotland. He was elected a Fellow of the Royal Society, and he spent part of the war as a code breaker at Bletchley Park. Well, Alec Aitken was Doug's maths teacher at Otago Boys High School. And I think, reading between the lines, I think he was somewhat of a father figure for Doug, for one reason in particular, in that later on during the First World War, during 1916, Alec Aitken and Doug's father, William, were in the same battalion of the Otago Regiment, and Alec was present the night that Doug's father was killed in action in 1916. So I think there was a particular bond between Alec and Doug, and this was reflected by the fact that there's correspondence into the 1930s and 40s, when by now both men were in Britain, and Doug asking for somewhat fatherly advice in some of the letters with career advice. So I think Alec Aitken was an eminent man and an important part of Doug's life. So following high school, Doug enrolled at Otago University in the Dunedin in the South Island of New Zealand, and this is his medical school enrolment card, kindly provided in recent days by Otago University, which outlines the subjects that he would have studied and the fact that he was living in college at Knox College. And this is his graduation photo. It's Doug is seated in the middle of the first seated row. And within a couple of years, just as an aside, within a couple of years, also sitting in a similar photo would have been another Otago graduate, Dr. Jack Lovelock, who would go to Oxford as a Rhodes Scholar and go on to win the 1500 metres at the Berlin Olympics. Also major influences in Doug's life were these two people, Irene on the left and Donald Grant on the right. And again, within the last few days, Nuala Grant, Donald's daughter-in-law, kindly provided this photo from the family archives. This obviously is taken much later in life, but Donald and Irene were leaders of the student Christian movement, first of all in Britain, then India, and then they had a spell at Otago University in the mid-20s, and I think had a great influence on Doug then and for the rest of his life. They were, as I said, members of the student Christian movement, which was a mixture of socialist beliefs and Christian values, and they were very much activists. And for instance, Irene volunteered in the early 30s to go to Nazi Germany to essentially smuggle the daughter of Bertolt Brecht to safety in Switzerland. So following his medical studies, Doug then journeyed to Britain, as many would in those days, and even to this day, to complete their surgical training. And this was one of his letters of recommendation. But in the meantime, civil war had erupted in Spain, and organisations were formed to mobilise medical aid to the Republic. So the Spanish Medical Aid Committee was formed, so the war started in July 1936, and this meeting took place in London on the 28th, where people were organising to send medical help in particular to aid the Republic. So this letter, dated in December 1936, is Doug's letter of introduction from Harry Pollitt, the General Secretary of the British Communist Party, offering his services and recommending him to the Republic, not as a party member, but as a fully qualified surgeon who would be of great use in providing medical services. So Doug headed to Spain, and as his original identification papers tell us at the bottom, he essentially enrolled on the 3rd of December 1936 and was immediately thrown into providing medical care to casualties in the Battle for Madrid in the winter of 1936 in very harsh conditions. Now, one of the hallmarks of Doug's expertise was to develop a mobile surgical capacity for the Republican forces. This is a picture that was obviously mounted for an exhibition at some stage, which is included in his archive. So these trucks were kitted out with operating theatre, sterilisation, dressings. They weren't mobile operating theatres. The idea was that they could quickly move with all the equipment required to set up an operating theatre in some sort of makeshift location. Teamwork was a hallmark of the success of these mobile surgical teams. And on the back of this photo, Doug has written that this was his equipo, his team. As the International Brigade, as the name says, was an international organisation with volunteers from all over the world. Doug is seated there in the middle, wearing sunglasses. To his left, with the blonde hair, was his scrub sister, Anne-Marie, who we'll talk a little bit more about in a moment, a Spanish surgeon on the right. And there was a great sense of camaraderie between nurses, doctors, orderlies, the whole team. And this is the first of Alec Wayman's photos showing Doug operating. And you can see it's hot. He's wearing a headband, he's not wearing a shirt, he's wearing some sort of apron. His assistant on the left is an American surgeon called Franklin Bissell. And in the middle is, with the blonde hair, is Anne-Marie Bash. She was a fully qualified Jewish nurse from Hungary who Doug formed quite an attachment to and a close relationship which lasted into the 1970s. Doug obviously spoke no Hungarian, and they communicated to each other then and in letters which are contained within the archive in French. At the end of the Spanish Civil War, Anne-Marie returned to Belgium and was a member of the Belgian resistance. And in letters, she explains how by day she worked in a German hospital, and by night she worked for the Belgian resistance. She was eventually captured, deported to Ravensbrück concentration camp, but survived. I think she puts this down to the fact that she was imprisoned as a political prisoner and was never identified by the German authorities as being Jewish. And as I said, there are letters into the 1970s between Doug and Anne-Marie. Again, another photo as Doug tries to deal with a very serious hand injury. And you can just see the anaesthetist on the right-hand side, who was one of Doug's two anaesthetists. This was Florida Perez, a Spanish nurse who Doug had trained to give anesthetics. And again, another view as they try desperately to get the best result for the patient from a very nasty hand injury. Unfortunately, we don't have any photos of Doug performing abdominal surgery, which was the area where he really made his name. He performed over 970 laparotomies in 2 years in Spain, which is, even by modern standards, an astonishing number. And the other thing to note is that really this was a major change from military surgery from the First World War, where abdominal injuries were regarded as being triaged into the hopeless category. People didn't operate on them, and the mortality was very, very high. Things started to change in Spain and then developed during the Second World War. And here's a photo taken, obviously, when surgery is finished. And I think you can get an idea of the strain on Doug's face from endless operating in very basic conditions. So it was heavy, stressful work. In this picture, Doug on the left, on the right is his other anaesthetist, a man called Peter de Sarigny, who was a South African, who went to Spain as a journalist. And I have to keep this story from my surgical colleagues because Doug taught Peter, a journalist, how to give an anaesthetic. And as an anaesthetist myself, it really just goes to confirm all the surgeons' prejudices about the relative merits of surgery and anaesthesia. So I haven't broached that with any of my surgical colleagues. But Peter himself was a very interesting character. He spent World War II in RAF intelligence, and having made, presumably on the basis of meeting one of the Bolting twin brothers, John Bolting served again as an ambulance driver in Spain, and with his twin brother post-war, they became very successful British film producers, first of some propaganda films during the Second World War, and later movies such as the adaptation of Graham Greene's Brighton Rock. And Peter worked with them as a film producer. He actually emigrated to Australia as an elderly man to live with his daughter, and died in Western Australia in the 80s. And I've been in contact with his daughter Lavinia, who's also helped with this project. One of the things that we know Doug was involved with in Spain was the development of blood transfusion. And here is, again, a Wayman photograph of one of the trucks that transported, they were refrigerated trucks that transported blood in glass containers. Again, they were mobile. And again, this was a stark contrast to the First World War, where patients with traumatic injuries could be transfused. We also know that as well as Spanish expertise in this field, one of the international doctors who helped develop this was a man called Norman Bethune, a Canadian. What we didn't know was whether Doug, what his relationship or his involvement with Bethune was, but we found this photo. So that's Doug with the surgical apron on in white, and that's Norman Bethune to his right, our left, standing next to one of the mobile transfusion trucks. So they obviously had a very close relationship. Norman Bethune, post-Spanish Civil War, he volunteered his services for Mao Zedong in China. And sadly, he suffered a needle stick injury operating on a patient during the Great March and died from septicemia not long after this photo was taken. One of the aspects, again, that differentiated the Spanish Civil War from the First World War was the role of aerial bombardment. It meant that warfare now could potentially involve the whole population. And the German Condor Legion and the Italians had heavy bombers fighting on the Franco side that made the protection of any field hospital essential. And the Republican forces were very adaptable. And here is the famous cave hospital at Fisbel del Facet, I think the name is. And you can just see in the top half of the picture, there's a huge natural ledge of stone. And just underneath that, you can make out perhaps some figures. And this was the entrance to the cave where Doug and other surgeons operated. It had a capacity of 120 patients. And this is a picture not taken in the cave hospital, but taken in a field hospital at Ebro, that's been reproduced in one of Mark's books. It's on a plaque that I'll discuss towards the end of this talk. And I think it shows the strain and the workload. Doug's trying to relax. He's having a cigarette. He's just taking a break from surgery for a period. But there were breaks and time to relax away from the fighting. Here's Doug again in the sunglasses. And on his left is, as he was then a medical student, who went on to become Dr. Archie Cochrane. Now, many modern day medical students are familiar with the surname Cochrane because Archie Cochrane was associated post-war with some of the first clinical trials and trial design, in his case for streptomycin for tuberculosis, and his name is now associated with the Cochrane Collaboration for Evidence-Based Medicine at Oxford University. Many people know that surname, but many people in the medical establishment are not aware that Archie volunteered to serve in Spain. Apologies to the Spanish guests who have signed in. I speak no Spanish, but here is one of Doug's testimonials that's now held in fact, the Russian archives, but describes his service. It's essentially his service record in Spain, and is a testimonial to his prowess towards the end. And again, similarly, an original document in Spanish from de Harcourt, who was the head of the International Brigade Medical Services. And again, apologies to Spanish guests tonight, but even speaking no Spanish, words such as brillantismo, calidad técnica, labor chirúrgica, you just get the idea that he was very well thought of. So when the fighting had finished, the international troops were asked to leave Spain. but their concern for their comrades who remained was voiced in things such as this letter to the Lancet. As you can see at the bottom, Doug is one of the signatories, Archie Cochrane is another, and names that many in the audience would recognise: Dr. Len Crome, Dr. Alex Tudor Hart, Dr. Reggie Saxton. So all these people, there was an ongoing commitment to those that were left behind. And one of the things that I, before I had researched this, I hadn't realised that many of the Republican refugees who were, in a sense, interned in camps in the south of France, the other side of the Pyrenees, many of them formed a nucleus of the French resistance in that area at the start of World War II. So reports were given in London to the Spanish Medical Aid Committee. And again, this is a letter published in the Lancet in late 1938, that in January there was a meeting where reports from returned doctors recounting their experience of modern military surgery, and Doug was one of the 4 people who addressed that meeting to give detailed descriptions of what they'd learnt in Spain. Doug then travelled back to New Zealand between the Spanish Civil War and the Second World War. And here is a copy of a telegram that he kept, and it's from the Narkawa Miners' Union, and it can from the Stockton mine. And last night I looked up on Google, because having lived in New Zealand, I had no idea where Narkawa was. It's a river that runs close to the tiny mining town of Stockton. So in pre-internet times, a very, very isolated small community on the west coast of New Zealand knew exactly what Doug had been up to, and congratulated him on his service in Spain. He also travelled around the country, giving speeches, first in Britain before he returned to New Zealand, and then in New Zealand. He was accompanied by some of the local MPs, and they really toured the country, raising the profile of the conflict, raising money for ongoing help to refugees, and Doug was very much a part of that. And this meeting took place in Auckland in May 1939. He then just thought that he should go back to Britain and volunteer to fight in the Second World War, but many of his surgical colleagues suggested that rather than, well, before that, it would be valuable if he could record his experiences from Spain in a book for the benefit of others. So here are 3 copies of the book Field Surgery in Total War that David Adams referred to in his original article. On the first copy on the left is the only copy I've ever seen with its original dust jacket. It's a first edition because if you look carefully under Major Douglas Jolly, it refers to him as a major in the Spanish Republican Army. The later editions refer to him as a Lieutenant Colonel in the Royal Army Medical Corps. The second thing to say is that pre-Second World War, Doug was very well connected with the surgical establishment, because to have a foreword written by Rear Admiral Gordon Taylor, who was a doyen of British surgery from the 20s to the 30s, that was quite something. The copy in the middle, in best condition, is actually Doug's own copy that lives in the archive, and the rather battered copy on the right, which I assure you is a copy of the same book, even though it's very difficult to read the spine, is Stanley Wilson's copy, lent to me by his son Roger. Stanley was in the New Zealand Medical Division. He wrote a letter from Greece whilst on active service, asking his wife, could she please buy a copy of this fantastic book, because everyone was after one, and could she send it in the mail, which she duly did. He obviously treasured the book, because when he was captured in the North African desert, he buried the book. And when he escaped from captivity, he went back to the site and dug it up and took it with him. But then the book suffered further insults when Stanley Wilson was transferred to the Pacific and fought with the Americans on Guadalcanal and dropped the book in the Pacific surf. So the book has had a rather checkered career, but is treasured by the family. So the book can be divided really into 2 sections. And it's this first section, which is the organisational section, where you can see point 2, the mobile surgical unit. That's the crux of the book and where it gets its prestige from. The second half of the book is much more just a systems-based guide to how to treat various injuries. Here was the traditional, really up until Doug's modifications, this was the traditional British Army model, which put the hospital a long way back from the front line. So nothing had really changed from the First World War up until, you can see at the bottom, 1939. And it involved transporting patients by ambulance trains and even ambulance barges. So you can imagine this is very slow. And on the right-hand side, you can see this 3-point forward system. So this was Doug's innovation. He brought the patients to frontline hospitals where effective surgery could be performed quickly. In this, they talk about the golden hour in trauma management nowadays. Back then, at least getting to see a doctor within 5 hours was revolutionary. So it was this 3-point system with hospital 1 for immediate surgery, hospital 2 for less immediate surgery, and the other hospital further back. So this 3-point system. So what did his colleagues think of the book? Rather than copying this review from The Lancet, I've taken a picture of Doug's the review that he kept in his archive. That's why it's creased. And so again, he presumably thought this was the best review because he kept it. And you know, it's very complimentary. It says this is as good as the best of them and exactly suited to the needs of the frontline surgeon. And it goes on to say that throughout, Dr. Jolly writes with shrewd judgment, and this book should be read at once by every young surgeon who may be called on to treat war casualties, and by every consultant who is still uncertain how far his memories of the last war fit into the actualities of this one. So this was cutting edge advice to the young surgeon, as witnessed by Stanley Wilson, really wanting a copy sent out from New Zealand to Greece. What did other people think? Well, Lieutenant Colonel J.C. Watts would go on to become the first ever professor of military surgery as a joint appointment between the Royal Army Medical Corps and the Royal College of Surgeons. And he writes in his preparations to go to war that fortunately for me, there had recently been the civil war in Spain, which had brought a number of improvements in the management of war wounds. These have been, again, well described by Jolly. New Zealand preparation for the Second World War. If you read the first line, this was Fred Bowerbank, who was a brigadier who was charged with organising New Zealand's military response. He says, if you do not know if you have read Jolly's work on war surgery, I do not know if you have read Jolly's work on war surgery based on the Spanish War, but it is a most important and valuable contribution to military surgery. So again, evidence to back up David Adams' claim in his original article that Doug's work was influential at a much higher level. But it wasn't just Commonwealth soldiers who respected Doug's work. Edward Churchill, who would serve with American forces and go on to be head surgeon at the Mass General in Boston, says at the bottom of this, he knows about Jolly's 3-point forward system, and he says, one of the few books I had tucked into my luggage to take to North Africa was Field Surgery in Total War by Douglas Jolly. He talks about the 3-point forward system, where there was a triage centre in advance of the farthest forward hospital, the number 1 hospital, which is where Doug worked for the most urgent cases, and number 2 hospital for the less urgent cases. So it was influential. Doug then, having completed the book, he joined British military forces, not the New Zealand Army. I think because he'd spent the 1930s working as a surgeon in England. But one of the things to say is that he had left, when he volunteered to Spain, he was about to sit the second part of his surgical exam, which is necessary for full qualification. And he volunteered to, his urgency was to get to Spain rather than finish his exams. So anyway, he goes to, first of all, to North Africa and serves also in Italy. And just as he'd been involved with the development of blood transfusions in Spain, he's involved in the early days of the use of penicillin in the Second World War. And this is a chest that was owned by a Scottish microbiologist called Major Scott Thompson. And the interest in this wooden chest is that in 1942 this is said to have contained the world's supply of penicillin. And the Medical Research Council, because penicillin was in such short supply, actually conducted clinical trials in North Africa and later in Italy, because it was trying to work out how to best apply what was a very limited resource. And as you can see from the bottom of the document, these studies were under the direction of Harold Florey, who won a Nobel Prize for his work on penicillin with Alexander Fleming, and also the neurosurgeon Hugh Cairns. Just as an aside, both of these men were Australian, both were from Adelaide, both spent their careers largely in Oxford, and Hugh Cairns as a neurosurgeon was consulted to look after T.E. Lawrence of Arabia after his motorbike accident, and that was really influential in his decision to promote the use of helmets for motorcyclists, first as military dispatch riders, but now as we would regard as a standard that motorcyclists do wear helmets. So again, if you look in the middle of this document, there's Doug's name again. He's by now a lieutenant colonel, and he published with a Major Hamilton details of using penicillin to help in the closure of large soft tissue wounds. So he was an active serviceman involved in medical research. This probably doesn't project too well, but this is a document we found in the National Archives at Kew last year, which goes to the problem that the military medics could see that Doug wasn't the only person who had volunteered without completing his full surgical training. You know, the call up to serve really took priority. But even then, the military medical top brass were wondering, and this is in 1942 at the height of the North African campaign, what was the best way to proceed with what were highly practically experienced surgeons, but who didn't have the requisite academic qualifications. And I think they were thinking particularly post-war. And as you can see, there's a variety of ranks from captains to majors and 2 lieutenant colonels. Lieutenant Colonel Stephen at the top there, Lieutenant Colonel Jolly. So he was one of these men, vastly technically and practically experienced, but not with the letters to his name. Along the course of the way, for his efforts, Doug was awarded a military OBE, and here's the letter associated with that. And then this letter, which I'll go into in more detail, was from his commanding officer, Harold Edwards. And it's really an incredibly complimentary list of achievements. And he says in the Italian campaign, you have 1, brought the specialties of forward surgery to a remarkably high standard. And it's just a list. Number 4, perfected the use of penicillin. 5, reduced mortality and morbidity for most types of war wounds to a level rarely equaled and never surpassed in any campaign in history. He then goes on to say, he talks about skin grafting, blood transfusions. Number 8, you've contributed scientific data at the Rome conference and in medical publications which will be of historic medical value. And 9 is an interesting comment. You have unselfishly allowed devotion to the welfare of the patient to triumph over professional rivalries. And then Harold Edwards finishes by saying, it will of course be for the historian to assess the worth of your contributions in relation to advances in all theatres of war, present and past, but I am confident, and I know Brigadier Stammers shares this confidence, that the record of your fine work will find a prominent and permanent place in the archives of war surgery. So that was Harold Edwards. And he mentioned before the Rome conference, and I apologise for the quality of some of these, but I've found it very difficult to get good copies. So there was a major Allied medical conference in Rome in 1945, organised by Harold Edwards, as it says at the bottom. And there were lectures on the treatment of war wounds, and it was a big deal. There was a reception by the British ambassador, and on Tuesday, the 13th of February, there was a special audience with the Pope. But Doug didn't speak. He was listed as a delegate, so he was there, but he wasn't asked to lecture about the treatment of wounds. So come post-war, and this is a picture of one of the limb fitting sections at the Queen Mary Hospital at Roehampton. Immediately post-war, well, what happens? The first thing we know is that Doug never achieves his final surgical fellowship. There are family recollections that he actually fronted up for the exam, but just couldn't go through with it. So he never fully qualified as a surgeon. Now, why was that? Having served almost continuously through Spain and in the Second World War, I think we can conjecture that there was an element of what we'd now call post-traumatic stress disorder. Later in life, he was definitely diagnosed with bipolar disorder. However, he made a new career, initially based in the north of England, in Sheffield and Leeds, in limb fitting and rehabilitation medicine. But by 1951, he'd moved to the Queen Mary Hospital at Roehampton, outside London. And in 1963, he was made the principal medical officer. And during that time, he made one of his personal friends, a patient who became a friend was Sir Douglas Bader, who everyone would recognise as a double amputee Spitfire pilot from World War II. What we also know is that in Adam's original paper, he regards Doug's career in the rehab and amputee setting as perhaps a bit of a failure, which I think is a little bit judgmental on the part of a surgeon, because here's a handwritten notes in Doug's handwriting entitled Society and the Amputee. And he says society as a whole must learn to accept not only amputees, but also handicapped and disabled people on the basis of their inherent dignity, ability and worth as human beings. So maybe I'm being, maybe I'm not being accurate, but I conjecture that Doug's service with amputees in Spain actually stayed with him, and this was very much value. It was work of a different nature, but I think to him it was inherently valuable, and we should regard it as such. What we don't know in those years is whether, and I'd be interested perhaps from some of the listeners, is to whether Doug ever attended International Brigade reunions. The family seemed to think that he didn't. Doug never wrote a diary, but he did keep a number of address books. And these, for a researcher, are an absolute goldmine, because there's just a list of names that lead off in so many different directions. The address book is basically, you could divide it into a number of New Zealand addresses. So we know that he kept up with his family, very much so, even though he never lived in New Zealand again. There are numerous high-ranking military and eminent consultants from the London surgical field. So even though Doug didn't qualify, he did keep up with these people, and I think they kept up with him. Then there are a number of addresses from Eastern European, French, Belgian, Polish doctors. And I think you can surmise that these are fellow Spanish Civil War veterans. And I think Doug probably visited some of these people, particularly close to home in France in the 60s and 70s. And other very interesting names, so, people like Hugh Gaitskell, the Labour leader, Roy and Phoebe Longy, the parents of future New Zealand Labour Prime Minister David Lowe, for instance. So it's a fascinating read. Here's Doug's passport from 1968, the year he married Jessica Kane. And I think one of the interesting things here is in 1968, 23 years after the end of the Second World War, writes his profession as surgeon. He still regarded himself as a surgeon, even though he never achieved his final qualifications and he never practiced surgery as a civilian post-war. In the 80s, the International Brigade Association went looking for its veterans. And this is a letter from Bill Alexander to Doug saying, look, we're trying to arrange some archives. I'd love to talk to you. And as you can see from the staples in the top left-hand corner, this is a number of letters, and it's really a letter trail of the IBA trying to track down Doug. Doug, unfortunately, by this time is an old man with early dementia. And the last letter says that, Doug can't communicate anymore, but we thank you for your support. And then later in 1983, Doug dies. And this is his death notice from one of the London papers. And as you can see, the International Brigade Association regrets the death of Dr. Douglas Jolly, sincere anti-fascist whose unique skills saved the lives of many fighters in Spain. And interestingly, there's a memoriam to Jim Brown, another further up, another International Brigade veteran. So just in the last few years, as I hinted at the start, the Wayneman photographs have really been rediscovered. As I said, Alec Wayman was a Quaker ambulance driver who took these photos. They were thought to be lost, but his son, John, retrieved them, catalogued them, and they've now been published. And then 2 years ago on Twitter, this photograph emerged, which was sent in by the son of a Hungarian volunteer. It was broadcast on Twitter, and there's uncertainty as to whether this is a photo of Gerda Taro. And Gerda Taro was the partner of the war photographer Robert Capa, who was herself a photographer, and perhaps many of Capa's photographs were taken by Gerda herself. She was unfortunately very close to the action, riding on the running boards of a car during a battle when a tank became out of control and crushed her between the tank and the car. She was taken to a field hospital. Now, there may be uncertainty as to whether this photograph is of Gerda Taro, but what certainty there is that Doug was the doctor on duty that night when Gerda came in and operated on her and looked after her all night, but was unable to save her. And then up to the present, 2 years ago, a group in New Zealand got together and organised the production park that was placed at the site of the Jolly family store that you saw at the start of this presentation. Family members were present. The Spanish consul flew down from Wellington, and this plaque featuring again the Wayman photo and giving praise to Doug's service in Spain is now there for all to see. And just to finish up with, I've probably gone over time, I'll just quickly go back to the photograph of Doug and Peter de Sarigny, because I think, and I just want to read a letter. This letter was written by Peter de Sarigny after Doug died. And it says, Doug was one of my oldest and dearest friends. We hadn't seen as much of one another latterly as one would have liked. Distance and increasing age separated us, but there was a special bond inevitably forged by shared experiences in the Spanish Civil War in circumstances of the greatest stress. All the marks of his absolute selflessness there manifested, amongst other things by his willingness and capacity to do his most exacting and exhausting work far beyond what seemed to be the limits of endurance and certainly beyond the capacity of his colleagues. The rest of his life, to my knowledge, was conducted in the same elevated spirit. His generosity of mind and spirit were unquestionable, and I believe him to be one of the truly true good men of my experience. So on that note, I'd just like to list some of the people who've helped myself and Mark in this research, and even people who've either contacted me or I've contacted in the last few days. And just to say, I would be more than happy to, for anyone who wishes to contact me on the basis of this talk, there's my email address. And if anyone is interested, the paper that Mark and I published, the biographical paper we had published in the Journal of Medical Biography 2 years ago, again, I would be more than happy to forward that to anyone who wants to drop me an email. Thanks very much.
Thanks very much, David, for that fascinating talk and incredibly moving tribute to Doug. It's a real treat to see these archival documents and also to hear from those who knew Doug and worked with him at the time. We've got 20 minutes or so for questions. I'm sure some people who've logged on have things to ask. So if you're able to raise your hand, the little blue hand on Zoom, if you've got anything to say. Alternatively, if you pop something into the chat box, I can relay that to David. Anyone? We did have a question. We wanted confirmation of the nurse who, the Hungarian nurse, the name of the Hungarian nurse who was.
Yep. So it's Anne-Marie is her first name, and then Basch, B-A-S-C-H.
So I think that's in response to Mr. Van's question. I've got a question. Was Doug then, was he interviewed during his lifetime then, or on his
I don't think he was.
No, okay.
I had the opportunity to, at the start of this, Doug's stepdaughter, I interviewed her in Canberra, and I asked her various questions as to, did he go to reunions? You know, did he talk about Spain? Had he ever been back to Spain? Which he said he never did. He was too, he was actually too, the family said he was too frightened to ever go back to Spain, unfortunately. And as far as I know, he wasn't interviewed. You know, those letters in the early 80s is the International Brigade trying to find him to interview him, but by that time it was too late.
So I've got a question here from Jill Brown. I'm just going to unmute you, Jill.
Hello?
Hello, Jill. Hopefully this will work in just a sec.
Does that help?
Yes.
Can you hear me now?
Yes, we can.
Hello, sorry, it's Seb Brown. I'm using it's my wife's computer. No, thank you very much. And as a sort of ex-operating department practitioner, I appreciate a little bit of an anaesthetic input there as well. So that was nice. But I just had a couple of sort of points to make. Very interesting. Just a couple of questions, really.
Sure.
One of the things you say is that the three-point forward system was his innovation. I think it sort of, my understanding is that it evolved out of systems that were coming to fruition at the end of World War One, but there were other people involved in the three-point forward system in sort of taking it forward in Spain